Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we're talking about what is hyperthyroidism, and I created for you multiple mnemonics in order to easily remember it. So make sure to watch my video until the end, and don't forget to subscribe down below if you haven't yet. And let's start now. Now let's start with the definition. Hyperthyroidism, as the name suggests, hyper means excessive. Thyroidism means thyroid gland. So, in conclusion, hyperthyroidism is defined as excessive production of the thyroid hormone by your thyroid gland. Now, before we go into deep details, let's talk about the anatomy of your thyroid gland. Your thyroid gland is a butterfly shaped gland located in front of the neck under your skin. Now, what are the other names for hyperthyroidism? We can say overactive thyroid, or thyrotoxicosis, or goiter. Now, what are the symptoms for a patient with hyperthyroidism? In order to remember this mnemonic: sweating. Each letter stands for a symptom, and we'll speak about each one in details. The first symptom is the first letter, that is the S. S stands for sweating. So a patient with hyperthyroidism, they will sweat for unknown reasons, whether it is cold weather or hot weather. The second symptom is the two letters WE, which stands for weight loss. Number 3, the two letters AT stands for appetite increased. Number 4, the two letters IN stands for heat intolerance. What do I mean by that? People with hyperthyroidism, they will feel hot at all times. Lastly is the letter G. G stands for GI tract or gastrointestinal tract. So the patient with hyperthyroidism, they will have frequent bowel movements, that is diarrhea. Now we are done with the symptoms. Let's talk about the causes. Also here there is another mnemonic to know the causes. There are 4 possible etiology behind the hyperthyroidism, and in order to remember the word GIST. The first letter of the word is G. G stands for Graves' disease. This is the most common disease that is associated with hyperthyroidism. Now you might heard it before in your dental exams that the Graves' disease is a type of hyper or hypothyroidism. Now, in conclusion, what is Graves' disease? Graves' disease is an autoimmune disorder that leads to excessive thyroid hormone production, leading to exophthalmos or bulging of your eyeballs. The second cause is inflammation. Inflammation of your thyroid gland can cause a temporary release of stored thyroid hormones, which can lead to thyrotoxicosis or goiter or hyperthyroidism. Number 3 is the letter S. S stands for solitary toxic thyroid nodule, or in other words, toxic adenoma. So if you have a single nodule around your thyroid gland, this will result in excessive production of your thyroid gland to produce an excess thyroid hormone. The last letter and the last cause is T. T stands for toxic multinodular goiter. So it is the opposite to the previous one. Previous we have a single nodule. In here you have multiple nodules that are wrapped around your thyroid gland, leading to excess thyroid hormone production. Now you might ask me, what is the treatment that we offer for our patients? There are a number of medications. Number 1 is anti-thyroid medication. The anti-thyroid medications or drugs like tapazole and propylthyrosol, they block the thyroid's ability to produce hormones, helping to control thyroid function. That is the first line of treatment. The second line of treatment is radioactive iodine therapy. This treatment involves taking radioactive iodine, which is absorbed by the thyroid and damages the cells that produce thyroid hormones. The last treatment option is surgery, removal of your thyroid gland equal to thyroidectomy, which is the complete or partial removal of your thyroid gland, which can, of course, definitely cure your hyperthyroidism.